Hi, my name is Megan. I'm 33 and I'm from Vero Beach, Florida. I had a total capsulectomy with a lift and fat transfer, and then I also had an additional fat transfer as well. My first procedure, I'm post-op for about a year and a half, and I'm about 3 months post-op from the last procedure. So what motivated me for looking into an explant was I started having a lot of breast implant illness symptoms, and I would say they probably went on for about a year before I really got serious about looking. I got to the point where I was having really bad skin rashes all day long, also having issues with eating in my stomach. And I would say I looked into this surgery probably about a year before I had it. So I found Dr. Lampert by looking on some Facebook groups. I found a few different doctors in South Florida that I was kind of looking into. My first consult was with Dr. Lampert, and coming into the office, meeting his staff, meeting him, I just fell in love and I knew he was my surgeon. So I believe Dr. Lampert was my best fit for surgery because coming into my consult, he spent a lot of time with me. He was not rushing me to make any decisions. He was very honest with me about not knowing if this would cure my skin rash symptoms. He believed it would help with some of my pain and other issues, but it was very nice to see a plastic surgeon being so honest and open and not just wanting to book a surgery and take some money. I would say my biggest concern prior to having my surgery was ending up with indents and not looking normal afterwards, getting an explant. And Dr. Lampert really helped me with those fears before surgery. So I had made the decision to have a 2-phase surgical process. My very first surgery, I had my explant, total capsulectomy, a small fat transfer, and lift. And after that, I knew I could, heal. I spoke with Dr. Lampert, and he thought it was the best option for me to heal, get everything closed up, and wait about a year for another fat transfer. That year to wait was a pretty hard year just to see myself look as different as I did. I can say now, after waiting and doing my additional fat transfer, I am extremely happy with the way I look and the way I have healed. I would say the hardest part of my recovery was just having to be still, kind of have my husband wait on me, not being able to lift items or lift our dogs. Other than that, my recovery was pretty easy. So after surgery, I have already noticed that majority of my breast implant symptoms have gone away. I do still struggle here and there with my skin rash symptoms, but my pain, my breathing's gotten better. Even my skin in general has gotten better. This did take a little while, but I would say about 6 months after I really started to tell a difference. So with Dr. Lampert, I had surgery at the ambulatory care center here, and I felt that it was a very personalized experience. You're really the only patient here getting ready for surgery. He comes in, marks you up, and I currently work at a hospital, so I know the hustle and bustle and rushing in all the patients through a pre-op and PACU setting, and this was just a little more comfortable and specialized for me. His anesthesiologists are also great. They work really well with all the patients and the nursing staff. So my overall experience with Dr. Lampert and his staff is really great. I felt like I was part of their family from the day I walked in the front door and never felt like I was just a patient or another number. The day of my procedure, they did a wonderful job keeping my husband up to date with every step of the way and how I was doing and in recovery. And even after my surgery, I feel like I can easily reach out to them with any issues or concerns I may have. I would definitely recommend your surgery with Dr. Lampert and their staff, whether you're doing an explant or just want a fat transfer or a liposuction. Anything that they do here, I believe they do a really great job, and they really care for all their patients personally as if they were family. And I would definitely pick Dr. Lampert again and my 2-phase process for surgery.